It's the most wonderful time of the year, and yet we all know somebody who has a difficult time during the holiday season, often leading to a rise of mental health support calls. A recent survey from the American Psychological Association reports the demand for anxiety and depression treatment is so high right now that 60% of psychologists surveyed say they don't have openings for new patients. Dr. Adrienne Bankert joining us right now. She's the Associate Chief for Practice Transformation for the American Psychological Association. Thank you so much for being here with us. You know, it's not just this time of year, but we're certainly seeing an uptick in these latter months for mental health support. So why are we seeing such an increase?
Well, it's been a difficult 3 years. So the stresses and the challenges have been accumulating for months for many, many individuals. So in addition to all of the uncertainty with the pandemic, we've had significant economic uncertainty, particularly in the past year. And all of that builds on families, builds on individuals, makes it hard for them to function. And kids are feeling the impact as well. They were really disrupted with the efforts to mitigate the spread of COVID. Really disrupted children's lives, and they're paying the price as well. So all of that cumulative effect of these changes has added up to impact how people are coping with the demands placed on them.
Yeah, and you know, not just kids, you did speak about that because there's a shortage of mental health professionals for teenagers, particularly, but we've also seen an uptick in contributing to crime and homelessness.
Yeah, we're seeing lots of challenges. When people are distressed and overwhelmed and can't get their needs met, many of them may report symptoms of stress and anxiety. But economically, if you don't have what you need to feed your family and to support yourself, you may have to do things that are not legal to get that. Or we may find people who are having difficulty with how they manage and express their anger. So you wind up with more conflict, more challenges in that regard. It's been rough for many people.
It has. Nearly 1 million Americans over the age of 55, they're aging alone without family as younger generations grow older, but maybe they didn't marry. Perhaps they have become isolated for different reasons. What's your advice to those who are 55 and older about maintaining positive mental health during their latter years?
There's so much that we can do. And I think we sometimes, American individualism, the desire to sort of be strong and do what we can, comes at a cost. And we need to really reflect on and reach out to and create those social networks. So if you haven't been in contact with family or friends of late, reach out to them. Phone calls are wonderful ways of connecting with individuals and build that social support network. But if you've really lost touch with a lot of people, figure out ways to find those new connections through community activities, volunteering for organizations that are important to you. Being engaged in your local world around you can make a big difference in terms of how we face the challenges and deal with what life's throwing at us.
Dr. Adrienne Bankert, thank you for joining us this morning. I know it's going to be something that a lot of families face this holiday season.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.